today.
Thank you, Leslie. Hi, everybody. This is Beth, and I just wanted to welcome you all to our webinar today and give a special thank you to Lori Oster and Megan Jacobson for joining us. They both work for the Better Choices Better Health, or with the Better Choices Better Health program through SDSU Extension, and so they've been partners of ours for about 4 years now, I believe, working to get this program off the ground, and they've done a great job doing so. They have a lot of really fun, exciting new things going on with their program. So I hope that they touch on that a little bit. We're excited for all the things that are coming with Better Choices, Better Health. But I wanted to offer an opportunity for everybody to have a refresher on what this program is and how we can potentially help impact the participants and the growth of the program. So I just wanted to, again, offer a refresher for everybody, for those that have had some education before on Better Choices, Better Health, and also for those staff that are newer who maybe have never heard of the program. Just give you guys an opportunity to learn more about it, hear what's new and exciting that's coming up, and again, just refresh on how we can make referrals and work together for our consumers that we serve that may be interested or may benefit from the program. So with that, again, Lori and Megan, welcome, and again, thank you so much for joining us today, and I will turn it over to you guys.
Thank you, Beth. This is Lori Oster, and I have to apologize. I forgot to inform you that Megan was unable to join today at the last minute, and so you will hear just from me. But so thank you for that introduction, and I'm excited to talk about Better Choices, Better Health with this group. So we can go on to the next slide, please.
Okay, it is on the next slide for us. I don't know if it is for you, Lori.
Oh, okay. I have to advance my own. Okay, I got it. All right, so Better Choices, Better Health, we started in 2014, so we're almost 5 years into offering the program in South Dakota. So we refer to ourselves as a suite of self-management education programs. We started with chronic disease self-management and have since included diabetes self-management, chronic pain self-management, and we're currently piloting a worksite model of the chronic disease program. And I'm not going to spend much time talking about that necessarily today. Also, we've just recently added falls prevention programming into what we are able to offer through SDSU Extension. So those are the Walk With Ease programs and Fit and Strong programs. And I'll touch on all of these programs a little bit here more as we go through the slides. But we're statewide. They're all adult programs, age or over, and they're offered as workshops, varying lengths. But the ultimate goal is really for those that are participating to learn skills that can help them better manage or improve their physical and mental health wellness. And as Beth said, we've been partners, a threefold partnership with the Department of Human Services, the Department of Health, and SDSU Extension since the program's inception. And I kind of have written there kind of what some of those responsibilities are for us as we've grown this over the years. And again, my contact information is there, but I'm the program coordinator for the Better Choices, Better Health program. Next slide. So
okay.
this is our suite of programs, and like I said, they're kind of color coded as we do our marketing. So as you'll see, the flowers on the side change accordingly for chronic disease, diabetes, and chronic pain, and then the worksite model in orange. And we have marketing materials in rack cards that can be ordered from the Department of Health's warehouse in Sturgis free of charge. Next slide, please. So on this sheet is one of our other marketing tools that can be ordered, but it just gives a very brief explanation of what the programs are, who they are for. Chronic disease is very broad. It can be for any participant to attend or their caregiver. Diabetes is specific to type 2 diabetes or pre-diabetes or caregivers as well, and has a little bit more information that is centered around managing diabetes. Chronic pain is for anybody living with a primary or secondary diagnosis of pain, and that can come from a multitude of different conditions. Next slide, please. And these are the flyers for the Fit and Strong and the Walk with Ease program. So the Walk with Ease program is sponsored by the Arthritis Foundation and just started in South Dakota in about December of this year. And so you'll see the contact information for the gals that are leading that program through SDSU Extension. But it's based as an evidence-based 6-week walking program, and they do a little bit of exercise and weightlifting along with it. And it's 2 or 3 times a week, depending on how the class is set up. The Fit and Strong program will be brand new. It falls under a fall prevention grant that was awarded to SDSU Extension in May, and that will be launched over the next 3 years. And it is specifically for adults that have osteoarthritis symptoms and a diagnosis of that, and to increase their strength and balance. And so I know that in the grant they had written in that this program would be launched in 3 counties. First of all, in South Dakota, in there, Brown County, Han County, and Custer County. Next slide, please. So this is just kind of a picture of our organizational chart, and you'll see that, again, everything is kind of housed under the umbrella of South Dakota State University and the Extension program. The leadership team, myself and Megan, we work closely together on the day-to-day management of the program, and with the Department of Health and Department of Human Services. And then we also have Dr. McCormick, who is our evaluator and data manager through SDSU. And we have accumulated some staff positions. We have a referral coordinator now that just started in April, and so we're developing that program. I'll talk a little bit more about that a little bit later. We've been fortunate to just have Amanda Crawford start as a AmeriCorps Vista member, and she will kind of help with some projects over the course of the next year in her opportunity that she's been provided. And we have a project manager that kind of helps oversee some of our grant deliverables. I mentioned the girls that are doing the Walk with Ease and Fit and Strong, and we're also bringing on community health workers starting sometime later on this year. So that's a new opportunity for our program, and I'll touch on that too. For our workforce, meaning our trained master trainers and leaders, we have about 75 people kind of scattered across the state in different locations. And the programs below, you'll see where the number that have been cross-trained to deliver those particular workshops, smaller numbers of those. And we do have some training scheduled coming up in the next year, so that we will add to our numbers to help continue to grow our program. We have a nice array of different partners and sponsors, and they're kind of depicted here. We also have an advisory council of 33 members from different disciplines across the state that really are kind of our sounding board and kind of idea bank that help us develop ideas and concepts to sustain this program. Next slide, please. So this is a picture of our state, and the counties that are depicted by little polka dots are where we have previously or currently offered a particular workshop. Any of our different types of workshops might have happened there. The diagonally crossed counties are areas where we are wanting to expand to, because we've had requests for those in those counties to bring it to their communities, or it matches some of the deliverables that we've had written into our recent grant award that we got. So we're, have plans to continue to expand and grow. Of course, we're always open to having any additional communities contact us to grow into their area, well, even if we hadn't had a plan for it. Next slide, please. So I'm going to talk a little bit about the concept of self-management, and this is kind of a nice pictograph that says 99% of all of our care is done by ourselves. We go for our clinic appointments, but literally you're there for a handful of minutes and you get checked over and you have some testing done and you get some information. But then it really is up to you to make sure that you carry through with the things that you've been told to do if you want to improve your health or maintain your health status. So we kind of use this in our workshops and in our trainings as we're talking about it, the things that we need to do self-management wise to maintain our health to the best that we can. Next slide.
Oops.
So
Sorry,
this
I went too far.
Okay.
Here. Workshop format, is that what we're supposed to be on? I'm sorry.
Yes, that's correct. Thank you. So
Yep.
this is just kind of an overview of when somebody's attending a workshop, what some of those, what's some of the things that they might expect or learn or how the process goes. So I'll first just say that all of the workshops are free to attend. And so, and they can also attend more than one. So if you start out with a chronic disease self-management workshop and then, you know, an opportunity presents in a couple of months that you could attend a diabetes self-management, that's absolutely fine. And it also, we've had people come back a year later that attended a particular workshop and they did the same workshop over again a year later and probably in a different location in their community and with different attendees. And so it's like a new learning experience for them, and that's okay with us. We do, people do have an opportunity to give a donation to the program. They get that information at the workshop, and we are always surprised at the number of donations that do come in from those who have participated. A particular class has a minimum of 8 to up to 16 participants that come together weekly for 6 weeks. Each session is about 2.5 hours. And it's a scripted curriculum and a scripted agenda that is followed very closely by the 2 leaders that are leading the workshop. And that is part of the fidelity of the program. And those breaks are in there specifically for people so they can get up and move around so that they're not uncomfortable. As we all know, sitting for that length of time can be difficult. And the group or the workshops are interactive. There's conversation that happens, there's activities that happens that prompts the participants to offer ideas or suggestions. They support each other. There's an expectation of confidentiality amongst those in attendance and with the leaders as well. And we are always very particular to make sure that when we're talking about our programs, you know, especially to those in healthcare settings, that this program does not replace any existing programs or treatments that might be offered. It really complements them. And so we make every effort that we can to cross-refer to other programs and have that expectation that the same things happens for our Better Choices, Better Health programs. So the snapshots on the side are just a couple of different books. If you're attending a chronic pain, you get the lower book, diabetes or chronic disease is the upper book. And with the chronic pain book, there's a Moving Easy CD that comes with it, and the other CD is a relaxation one. All of those materials are excellent. The participants really enjoy them. They get to keep them. There's no additional charge for them either. Next slide, please. So, you know, what are some expectations for those that are participating? You know, the primary goal is that participants have increased self-efficacy by attending the workshop, that they become really confident that they are in charge of their health, that they can take care of themselves, and they can learn the skills that they need to help them manage their health and have the confidence to reach out for questions or assistance when they need to do so. In the workshops, they practice those skills, and we refer to that as the toolbox. You learn the tools in the toolbox, and it's kind of a graphic picture of it here, but we have charts that are set up, and we talk about those, you know, and we practice those, you know, week by week, and people get very confident in how they can do that. It's based on empowerment. Again, back to that confidence. Each week you make an action plan with what you can do, and it really is what you think you can do by next week, what's realistic for you, what you can manage, and how confident are you that you can meet that goal. And if you don't have a confidence level of 7 or more when you talk about your action plan, then the others that are in attendance kind of give you some suggestions or help you find different ways that maybe you can become more confident to do so. So again, it's that mutual support. And I'll just say that we've had countless times after workshops where some of the group members or even all the group members, especially those that are offered like in a senior center or that type of an environment, assisted living environment, they continue to meet weekly at that same time and still do action plans and still support each other in those same ways. So, and then the other thing, to be really effective, you know, there's 6 sessions and attendance is expected at all sessions, but they're all different. And so if you miss out on something, you don't get the full experience. Participants can only join in the first week or the second week. After that, it's closed to new members. And again, you have to attend 4 of the 6 sessions to be considered a completer and get a completion certificate. Next slide, please. So this is kind of an overview of another way to find out what's all being taught in a 6-week workshop. This is the breakdown from the chronic disease workshop. The diabetes and chronic pain ones are similar, as you might expect. For diabetes, you know, it has a little bit more diabetes-related education. But the ones that are listed in the green lines, those are repeated, as you can see, almost every week. And so those are kind of cornerstones of the tools and practices that you learn and that you get good at. And the rest of the topics are covered throughout the 6-week program. Next slide, please. And so we always want to make sure that people know that the workshop is really for them. I mean, it meets people. We say it meets them where they are. It allows you to focus on you or what's important to you on this at this particular time in your life, and it's different for everybody else. Anyone in any type of chronic health conditions can attend. And we've had workshops where there maybe has been 13 people there, and they've all had 13 different conditions or reasons of why they're there. This is a quote from one of our participants that I think is kind of a big statement, especially for people who live alone or people that don't necessarily feel like they had a lot of support around them. So that feeling of being isolated and struggling with their illness and really feeling defeated, but after the workshop, you know, realize that they're not alone because there are countless people who feel the same things and have to deal with the same things, and realizing that was just such a upper lifting realization for her that it took a lot of pressure away. Next slide, please. So again, you know, who can benefit? Well, you know, really just about anybody can benefit. You know, there are practical solutions, practical life types of things, as well as, you know, really getting a better handle on how you should look at nutrition or how you should, you know, try to integrate physical activity or exercise into your life and what it can do for you, even getting enough sleep. Or I spend a lot of time talking about managing stress and how that can, you know, if you don't get enough sleep, or if you don't eat the right foods, you know, or if you don't get enough water, how those things can trigger other symptoms that you deal with. Next slide, please. So our goals for participants, I've kind of talked about a little bit, and again, the whole program from when it was developed in the 1990s at Stanford University was based on self-efficacy and making sure that participants can improve that by participating in the workshop, and really can walk away from it with learning tasks that help them to better take care of themselves and their health, to carry out normal activities, the day-to-day, the things that they want to do, and really manage those emotional changes that go along with chronic health conditions. It was developed at Stanford, but now it's managed through the Self-Management Resource Center in California, and it's still though that is still the organization that were the founders of the program. So still Dr. Kate Lorg was the primary conceptual person for the program, and she's approaching 80 years old, and she's still active day to day in making sure that this program is still offered. It's in 50 states, 27 countries, and about 15 different languages, I think, right now. And it is an evidence-based program. Next slide, please. So here's just a couple of other quotes from participants, talking about their experiences. And, the one particular one I'll draw out here is the fourth one down from Randall, where, he's talking about his disease. He didn't deserve to get it, and he was angry for a while, but he has to deal with it. So he said, but I got it. I have to accept it, and I have to use the skills I learned to manage my health. And it's, it's not a very big sentence, couple of sentences, but it really carries a lot of impact when you read it. Next slide, please. So what's the why? Why is it important? Why are we talking today, and why are we promoting it across the state and hoping to continue to grow the program and sustain the program? Because disease management is very, very important. And we know that increasing prevalence of chronic disease, if you read news or listen to, the radio or the TV, we're at some point sometimes near crisis numbers. There's a lot of things in the news today about chronic pain and overuse of opioids, and concerns that are all across the country regarding that. But this program really can, if delivered and attended, can affect population to really change their health course, to change their health behaviors, and to really make a difference in where we are going, in the country. So in South Dakota, this is from some of the surveys or data that's collected, but the average number of poor mental health days per month is 3.1, and the average of poor physical health days per month is 3.7. So you're looking at about a week of time there for some of the people in South Dakota that deal with not being able to work because of those things, or not being able to do the things that they want to do. And so there is research, not necessarily in South Dakota, but national research, that after attending chronic disease self-management workshops, participants reported fewer numbers of unhealthy days per month. So that's really encouraging. In South Dakota, though, we know that $3.8 billion were lost in 1 year due to decreased productivity at work, or the cost of medical treatment that employees had. And that equated to over $4,500 for every single person in every South Dakota community. And in the other study that I read about healthcare costs and productivity among employees, was that the most expensive health conditions are these chronic conditions that we see and we talk about: obesity, arthritis, back pain, and depression, all things that are addressed in our workshops. Next slide, please. So this is just another look at the why it's important and related to chronic disease. So this is from the South Dakota Department of Health, the top 5 causes of death for chronic conditions between 2010 and 2014, listed there on the left. Most multiple chronic conditions increase the risk of hospitalization, healthcare costs, limitations to daily exercise or activities, and about 1/3 of all South Dakota adults have more than one chronic condition. And even studying, while we're not a children-related program, but the fact that 1 in 15 children have multiple chronic conditions in South Dakota is paving the way for our chronic disease prevalence to continue to increase. 66% of total U.S. healthcare spending is associated with those that have multiple chronic conditions. Next slide, please. And then one last little study that kind of, does show, the why again. So there was a study done in 2012 about chronic disease self-management programming. So of 1,000 participants who attended and completed a workshop, they showed that 41% of those had increased physical activity. They spent more time doing exercise because of their participation in the program. 21% said that they had less symptoms of depression. 6% had improved quality of life. 12% were better, took their medications better, they were compliant in that, they had better communication with their providers. 32% had a reduction in emergency room visits and utilization of hospital, which came to an estimated savings per person of $740. So I want you to remember that number as we go forward here. But potentially, there's cost savings there. When the first 3 years of our program, we tracked a lot of data ourselves because we wanted to know, even though it had already been evidence-based and the research was proven, we thought we're South Dakota. We want to make sure that when we're talking about that we can back it up. And we're pretty comfortable saying that our information mirrored what we already knew, what we already had heard from our national partners. Next slide, please. So chronic disease self-management outcomes, again, just another way to think about it, but increased physical activity, improved health status, the psychological well-being improvement in the depression, less anxiety, decreased feelings of fear and frustration and isolation, that improved confidence and communication with not just providers, but also with family members, more energy, less utilization of healthcare services, and just participation in an evidence-based program. Next slide, please. So we do an infographic every quarter that kind of shows our program growth and kind of expansion and what's kind of going on. So this is the last one that was done. And so it's a calculation of when our first workshops were offered in October 2014 through March of this year. And so we've had 1,377 participants that have attended a workshop, and 67 of those were completers, meaning that they attended at least 4 of the 6 sessions. We have 85 leaders, and that's kind of the breakdown again on what they're all trained in. So we've offered 148 workshops through March, and there's probably been about another almost 10 more workshops, I think, on that. So, we're well over 150. As you might expect, the 93% of the people that attend a workshop are white. Majority of them are female, 79%. We have about 25% that indicate that they are disabled, 41% that live alone, and about 70% say that they're over the age of 60 years. Our youngest participant's been 18, our oldest has been 93. So it's pretty broad. And we've had a lot of different age differentiation in a workshop, and you might think that that could be awkward, but as reported by leaders, it went just as well as anybody else, any other type of workshop would do. We ask on a demographic survey what type of chronic conditions or how many chronic conditions, that people have, and we have a whole selection of different types of chronic conditions, but the highest ones are high blood pressure and arthritis, diabetes, depression. Chronic pain is kind of steadily making its way up the list as something that's highly recognized. Next slide, please. Oh, actually, I told you to remember that $740 savings. And so I did a little bit of math. And so on using, if we had 1,500 people in South Dakota that have attended a workshop over the last almost 5 years, and if we went with the assumption that that was $740 savings per participant, that's $1 million that's been saved in healthcare costs over this about 5-year period of time, or about $225,000 annually in healthcare savings. And I heard that, how to figure that on a webinar once with some national partners, and I thought, I've never really looked at it that way. But it's kind of a aha moment when we started talking about it, what the potential is there for even cost savings in South Dakota. So are you on the referral coordinator and wellness coach page now, Leslie?
We sure are. We sure are, Lori.
Okay, I got off there, so I wanted to make sure we were going forward. So
Yeah.
this is Bridget monitoring. She started in April as that referral coordinator, and we're really excited about the potential for that because it's a software that lives in the cloud program that is specifically for chronic disease self-management programs and tracking data that's shared through our National Council on Aging and Administration on Community Living. Require that information from our program, and so it's nice for the data management, and we can print all kinds of different reports for partners, that they will be interested in. But it's also our referral tracking process. So while participants don't necessarily have to have a referral from a provider or from anybody who cares for them, and they can self-refer, we do have mechanisms in place through fax or the electronic medical record, about a toll-free number and an online process that anybody can register for a workshop or sign up for one. But the referral piece is really developing relationships with all kinds of different partners and clinics and practices and providers to really make it as easy as possible for them to really connect their patients and clients with our programming. And so, we're excited about growing that and using that because we see that as a real nice opportunity to really sustain our program. And the other really exciting thing also about this position is that we felt it was really important to, based on talking to past participants, that they go through the workshop and they are excited about it and they feel good about what they've accomplished. But then, it's happened to all of us that, if you're not continuing to have that connecting point, that sometimes, we just aren't able to maintain it. And so they worry about that. So we will be putting together kind of this wellness approach to help workshop participants or workshop alumni, as we might call them, continue on their health journey. So putting together in the communities where we're offering workshops, a catalog of next opportunities for them. And it could be joining a fitness program at a local gym, going to the senior center and partaking in some of their activities, becoming a Shine volunteer. I mean, whatever's available, whatever we can put in there, just so that there are options available. Next slide, please. And so, we encourage involvement, and I'm just sharing this because we talk about it, but we want to grow. We want to grow more, have a bigger presence in the communities that we're in and get into the communities that we're not there yet. And so how can that happen? Become trained as a lay leader or start off by attending a workshop, recruit volunteers within your community organization, be a promoter of our program, advertise it within your work world, host a workshop in your community organization or workplace. I mean, those are the things that we talk about that really help us grow and sustain. My question to all of you is, what are the best ways to market Better Choices, Better Health programming in your work communities and where you deliver services to your clients and consumers? And so, I'm interested in that. I know previously, I think because we did have a participant that had gotten a RAC card, in a mailer from through her waiver program. So I know it's been done before, but I love that connection.
Well, that is a good idea. LTSS staff, if you have ideas to help Lori with this, feel free to unmute yourself and answer her question or type it in the Q&A. I guess I'm kind of wondering if we have Better Choices, Better Health RAC cards out in all of our offices or not.
I can, we have a fax form that you can order off of, and maybe you have it, but I can send that to you, Leslie, if you would just forward that out maybe to everybody, and they can take a
Sure.
look at it and make it easy to get those
Sure, I'd
materials.
be happy to. Is that just through the regular Department of Health brochure ordering site?
Yes.
Yeah, okay.
And it's listed under the cardiovascular section. I don't know why, but that's where it's listed at.
Yeah, that's kind of weird, but okay. Yeah, if you want to send me the link, it's been a while since I found that. So if you want to send me the link, I'd be happy to share it with everyone. And I'll, if it's okay with you, I'll PDF your PowerPoint and send that along with it so that they have all this information on paper.
Sure, that'd be great.
Anybody else have any ideas, or can any of you on the webinar let us know if there are brochures or rack cards for Better Choices, Better Health in your offices?
Okay, I'll continue on. I got just a few slides here left. I'll go to the next one. So we've talked about, how do you know if somebody might be interested, or what are some trigger points that might come up in a conversation or such that might be an indication that attending a workshop might be good for them. So, it's kind of an emotional trigger, or do they have a lot of frustration or sadness or those feelings of isolation? That word isolation comes up a lot in workshops. And so some of those things, well, this might just help them, kind of work through that. The readiness to take control, they want to do something. They know that they've been struggling with this or that, or they're looking for an answer that maybe will make them feel better. Well, maybe attending a workshop is that thing that they're looking for. But they really are interested in helping others. Maybe they want to take a workshop, but maybe they want to become a leader because they see the value in it and they want to help get that word out. And then they've already done some types of previous steps. So, they've taken a cardiac rehab program or a Parkinson's support group or something like that. And they see the value, what they learn from that. And so they're interested in other options. Next slide, please. And scheduling workshops is pretty easy. You just need to have a location that can safely accommodate up to 20 people because of the leaders and what. So, we've had interest before where, but then there wasn't parking enough for people to go, or the bathroom wasn't on the same floor as where the workshop was going to be held. So those types of things. So when we say safely, it means making sure that it's accessible for everybody. We've offered workshops in community centers, in conference rooms, senior livings, churches, libraries. It's pretty broad. There's been a variety of different areas because of the fidelity. Go ahead.
Can I ask you a question about that, Lori? This is Leslie.
Yeah.
For the assisted living or senior living facilities, how do you guys usually get connected with them? Is it the administrators or the social workers within those settings reaching out to you?
Yeah, it's all the above. Their activity coordinator. I'll bring up Sunnycrest here in Sioux Falls, and we kind of are on a rotating schedule there now because they just include into their regular activity scheduling about 3 times a year. And they kind of have varied the programs a little bit. It's been successful. And they set the room, and then, people are excited when they see it coming, and we've had really no difficulties filling a workshop class there.
Yeah, I would think so. I think that would be a really perfect partnership there.
Mm-hmm. So it says on here that a minimum of 10 people, but rural, sometimes it just doesn't happen that way. And so we've done workshops. We like to say we have to have a minimum of 8. We've started them with 6 or 7 with the hopes of getting another couple people in week 2. If we don't have at least 6 people, then we have to reschedule them or postpone them for a couple weeks to kind of, get a couple more people signed up.
Okay.
And because of the length of time, then we always, depending on where the workshop is held or who the host is for the workshop, it's always nice to offer some snacks or a little water or drinks or something like that because they are there for fair length of time, and there are breaks. And so that's just kind of one of our, it's not required, but we sure like to do it. Next slide. So
yeah, I don't know, just real quick, I don't know if you noticed, but in the Q&A, a couple people have commented. It looks like Aberdeen has a poster, but not cards. Sturgis has the rack cards. Watertown does not have any rack cards. So it sounds like our LTSS offices need to get some supplies for Better Choices, Better Health ordered.
All right, that's great.
Leadville doesn't have anything, so yeah, we'll get working on that, Lori.
Okay, well, I'll send you some stuff out, or the sheet out, and I'll tell them to hopefully get prepared to be mailing out a bunch of Better Choices, Better Health stuff. So this slide is, I talked about trainings, and and you can share the word, or if there's an interest, for yourselves, we love all of that. So we have some trainings that are scheduled. We have a chronic pain training in Huron, where we're holding it in Huron in September, and then a chronic disease self-management training in Sioux Falls in November. And then we do have a chronic disease planned in Pierre. I don't have dates yet for that, but we kind of try to do them where, number one, where we have to grow leaders because of some of the deliverables we have in our grant. Where we're lacking, Pierre, we're just desperately lacking leaders there, and so we just really want to target that area. And the difference between a 4-day chronic disease and a 4-day chronic pain is it's there. If you do the chronic pain 4-day training, that's the only workshop that you can deliver. But it's been such a high, a high interest level for that we felt we needed to offer that. And so that expectation is really not to have a full training class in Huron, but to pick a location where people would travel to on the east side of the state. And we plan to offer that same thing on the west side of the state in the spring. So the cost to attend training is $250 if you're sponsored by your employer or organization and they plan to offer it within your work time and that type of thing. But if you apply as a volunteer, we work to make sure that it's at no cost. So, I don't want people to get scared off by the fact that it's $250, because if you don't have an organization that supports you and you're interested in becoming a leader, we will figure that out. Next slide. And this is, we're new to the community health worker world, and and much of South Dakota is as well, but we're kind of excited about a position that we've been talking about for several years, and how we could offer that liaison between the community and the health, clinical setting, to make sure that especially those in underserved areas or that have underserved needs can bridge that gap a little bit easier. And so they will be specifically, called the Better Choices, Better Health Community Health Worker, and work with the Nutrition Assistant Program for SDSU Extension, delivering chronic disease self-management education, even one-on-one, but then also facilitating workshops in communities. So this is a position that just opened up, and so I'm just sharing it here with others to share with somebody that might be interested in taking a look at that position. And my last slide is my thank you slide, and I really appreciate your time and attention, and I welcome any questions. My contact information is at the beginning and at the end, and my little takeaway for you is give yourself what you need to be full, because self-care that we all need to do is a constant practice. So thank you very much.
Sounds like nobody has any questions, Lori. I guess I was on mute and I didn't realize it. So thank you for your time today. I really appreciate it. Can people email you directly if they have questions then?
Absolutely.
Great. And if you want to send me that email, I'll make sure to get that sent out to all of our staff so they can order more cards. And we'll be posting, I'll be sharing the slides with them as well so they have a copy of your contact information.
Okay, sounds good. Thank you so much.
Thanks, Lori. You have a great day.